It's been a pretty extraordinary thing to witness, to be able to see the entire kind of, I'll say, world economy adapt to what's going on with coronavirus right now. And Google Cloud is a business that allows organizations to be able to rent the power of our computing farm by the minute. And Google's computing farm serves billions of users. And so I would tell you that there's a whole variety of things that I'm seeing that are unprecedented, just in terms of organizations like essential organizations needing to stand up websites or needing to be able to support their users, like hospitals, retailers and manufacturers having to deal with unexpected spikes, and organizations being able to deal with working from home scenarios and study from home scenarios. And so it truly is, from a computing profile perspective, a completely different dynamic than anything I've seen in my career.
So what are some of the use cases, the needs that hospitals, healthcare workers, and other essential services are facing right now?
Yeah, I would tell you probably the first and foremost thing that most organizations, most hospitals and essential businesses need to do is communicate with patients, communicate with the public. And so we're doing a tremendous amount of work around things like chatbots to be able to help hospitals be able to answer common questions as it relates to COVID-19. We're seeing a really significant surge in telehealth. Advent Health is a great example where we actually help them deploy Chromebooks into patients' rooms so that patients that wanted to be able to communicate with their family, whether or not they're having a baby or whether or not they're dealing with COVID-19, to be able to communicate with their family members. We've helped Oklahoma Department of Health as well deploy Chromebooks, and Doctors Anywhere be able to accomplish telehealth. Then you've got things like tracking of supplies and tracking of ventilators and tracking of beds. And so we've been very involved with organizations like HCA and the Singapore government in being able to track the actual medical supplies and making sure that the right supplies and the right beds and capacity is making it to the right patients. And then finally, I would tell you research. There is a significant need to be able to stand up very large data sets. If you can imagine someone that's studying a particular population that has a high degree of resistance, and another researcher is discovering or working on a drug that is showing signs of creating resistance, they need to bring together massive data sets. And so we're working with the White House around their open data initiative for COVID-19, and our Kaggle initiative is being able to really help researchers and hospitals and healthcare workers be able to come together and collaborate on the cure and resistance.